Thank you so much for that introduction. I really appreciate it. I have to say that it's been 14 years since I've been back in the Cayman Islands. I started my medical career here right down the street at St. Matthew's. So I haven't been back, and this has been a great opportunity to come back as a full-time practicing physician and working with Cleveland Clinic and really kind of hearing a lot about the international efforts and practices that have been going on with various organizations in South Florida and the island that I first visited 14 years ago. So truly excited to be here. So without further ado, I'm going to just take a second to learn this clicker here. Okay, perfect. Am I going backwards? So just a little bit of a brief agenda before we kind of dive into some of these topics. We're going to spend a lot of time looking at what sustainable healthcare really is in terms of its background and basics. So when I put together this presentation, I really learned a lot about sustainable healthcare, really kind of tied into some of the work that I'm doing right now back in education in my master's in health administration, really kind of looking at the intersection between clinical operations, patient care, and how do we mitigate a lot of those efforts in terms of sustainability for our future generation. So I learned a lot in the process, and I was able to apply some of this, really tying to the work that's being done here in the Cayman Islands and the work that's being done in our own clinical practices back home. So we're going to look at some of the challenges and concerns that we face here on the islands. I'm sure some of you obviously will know more than me, so definitely enlighten me as well in terms of what sustainable healthcare really entails in the islands. What are the sustainable practices that are being completed in the international kind of setting, so hospitals all around the world. Some of the sustainable practices that are already being done here in the Cayman Islands. We will look at sort of the transaction between nature and medicine. So a lot of the influence of our ecosystem and the environment that we practice in, and how does that really tie into our daily practice and the future of how we do practice. I'm not going to dive too much into artificial intelligence, but I'll kind of relate it to how it relates to healthcare sustainability efforts, and then the partnership between Cleveland Clinic in Florida, as well as Cayman Islands and the associated healthcare organizations here. So really excited to be back. So some of the questions to really think about before I dive into some of the topics is, what do you think is the biggest challenge that the patients, population use providers, or those experiencing the healthcare system here on the island, what do you think is the biggest challenge that people face in terms of access and equity to healthcare? What do you think are the resources that are already there or perhaps are needed to alleviate some of these concerns? And what does sustainable healthcare really look like in your own work setting? So here in the islands, in your own work environment, that could be really any aspect, taking care of patients, maybe you're on the pharmaceutical end, dispensing medications, or engaging in health delivery machines, for example. So just think about that when we're going through this presentation. So I wanted to give a little bit of a snapshot in Family Islands. So some of you may or may not necessarily be from here, and this was a great learning opportunity for me as well. So very much of a mixed payer health system, similar to where I grew up in India. So we have a public health system and we have a private health system as well. So experienced a few in my life. I've been a very publicly funded health system where I grew up in Canada. So to see sort of the dissection between both in terms of how those challenges are unique in both systems and really the transaction between both of those factors plays a role in kind of when we think about sustainability efforts in healthcare. So we have major hospitals here. Some of the hospitals obviously offer a lot more of tertiary care facilities, emergency health services, as well as access to many primary and preventive services, especially for public health, which is extremely important when we think about any sustainable efforts in healthcare. So I wanted to highlight some of the strengths of the islands and what amazing work that's being done by the leadership as well as the physicians, nurses, and all the staff that are working within healthcare within this island. So we have high standards and quality of care associated with Joint Commission International Seals of Approval on many of our sustainable efforts in healthcare organizations here in Cayman Islands, including the private hospitals as well as the publicly funded hospitals alike. We have increased access in the last few years associated with offering for specialty services such as oncology, cardiology, orthopedics, neurology, and so on, that does not necessarily rely on travel to international facilities. However, we still do encourage it for services that are not necessarily available on the island. We have an establishment of services here that allow for increasing 24/7 access to emergency health services, even on our smaller neighboring islands, health centers, as well as clinics that allow for public access to services such as vaccinations, primary care, as well as other public health facilities. And this is really kind of highlighted by some of the strong public health indicators that we see, where in life expectancy, especially when you invest in a lot of primary care and preventive services, life expectancy improves. And the overall disease morbidity as well as cost burden associated with this significantly reduced as well. In addition, we see that some of the other things that have expanded in the islands is the access to medical tourism. So we have strong partnerships with facilities such as Cleveland Clinic here in Florida, which allows patients to have improved access to some of these specialty services that may not necessarily be found here, as well as partner up with physicians and other providers alike to improve the care for our patients and care delivery. We also have expanded access here to mental health services, especially with the expansion of telemedicine that we've seen after COVID. And I think that's obviously Dr. Irons as well pointed out earlier is a very, very important aspect for patients and providers alike. Legislative reforms with, supporting of advocacy and policy efforts by ministers of ministry and ministers of health and health and wellness is very important in sort of supporting some of these sustainable effort practices and really achieving those high qualities of care. And last but not least, I think this is something very important, it's not necessarily highlighted so often, is really the transaction of complementary and alternative or traditional medicine. So having grown up in India, some of the things that you might, your grandma or your grandpa might have necessarily prescribed you might be a little bit more effective than the Robitussin that you might find over the counter. But some of those derivatives are kind of the practices associated or inbuilt in the culture associated with the people that we serve. So something that I learned in primary care is really to use that in your own value and how you treat your patients. And it plays a large role in looking at some of those sustainable practices within your own environment. So traditional bush medicine or integrative medicine, as they so call it, is very important in the islands and also some of the patients that we see back home. So this takes into account some of the challenges, right? So all the good things come with its own challenges, and even within the healthcare systems that we have back in the United States, there's always going to be strengths and weaknesses associated with our access for patients. So some of the challenges that are posed is really the expansion of specialty care, like I touched upon before. So not having access to some of those tertiary services that are very important for our patients, that can cause significant amount of disease burden in the population, and as a result, cost burden. This is especially true with the aging population that we see, wherein by 2035, we'll have a significant number of patients here that are going to be over the age of 65 that are going to need significant different services than you would normally find in younger patients. Healthcare spending has also surged, so between 2018 to 2023, the government expenditure here on the Cayman Islands for healthcare has significantly increased by at least 70%, and it consumes now nearly 1/4 of the budget associated with the government. So there's large amounts of liability associated with not only taking care of our aging population, but also investing heavily into some of the public health services that are very critical for preventive medicine so as to reduce disease burden in the future. So some of these constraints also include capacity constraints, so in terms of resources available, as well as workforce shortages, as there's always influx of people coming in and out of any sort of practice environment. We're also talking about some of the strains associated with access to certain medications, pharmacies being able to keep up with the accessibility to some of these very important and life-saving medications as well. So sustainability concerns are very important, and that's extremely true, especially for a smaller area and smaller population. And that really indicators that we really look at to see how much of those patients really require the type of tertiary or higher level care, preventive services, and where do we really put in our efforts to be able to strengthen our primary care and preventive medicine workforce so that we can think about how sustainable these healthcare practices are going to be in the future in terms of reducing disease burden as well as cost burden as well. So, sustainable healthcare. Many of you may or may not have heard of sustainable healthcare. I'm going to dive into like 5 main core concepts of what sustainability really looks like, and I try to keep it as apt as I possibly could for this conference. So, before we go about kind of diving into the 5 major aspects, I want you to kind of think about what are the different pressures, right, on human health. So we have the aspect of the environment, how much waste is being generated by our healthcare practices, how much of the economic impacts are we having as a result of, manufacturing a medication, and where does the social construct kind of play into this? All these 3 things are actually very important. It's not just the monetary aspect associated with taking care of the population, but it's really the concept of mental health, for example, as well as the financial burden associated with not targeting certain disease processes and the impact that it'll have on our environment, because that is a very sort of symbiotic relationship that we do have with the environment that we are part of. So I want you to kind of think about all of this, and I also want you to kind of add in the thought process of what are the constraints, right? Are there legislative policies, insurances that are kind of playing a factor into how we engage or don't engage in sustainable health measures, the demographic pressures associated with the fact that people are living longer, so there's a larger aging population as a whole. We're also thinking about the fact that there's issues associated with budgets and funding all the time at the hospital system, at the government level. All of these things play a very big role into sustainability in healthcare. So by the overarching definition, sustainable healthcare really refers to creating and maintaining a healthcare system that not only meets the current needs, but preserves the resources that allows for equitable access and improves health outcomes for the current generation, but more so for the future generations as well. So it involves making healthcare organizations and practices absolutely more sustainable, more environmentally friendly, economically friendly, and I can mention socially sustainable as well. So this new concept has gained a lot of momentum, something that I really kind of learned in my own course and while I see it in my own clinical practices. The concept has gained significant attention because a lot of those things that we may not have thought about 20, 30 years ago, such as climate change, resource scarcity, and the growing demand for healthcare services are true, and these are things that we're facing right now. So the 5 major aspects of sustainable healthcare take into account the environment, the economics, the social construct, health practices, and the workforce. So I'll dive a little bit into each one of these topics. So environmental sustainability, just give you some brief examples. That includes basic things like you would think about, turning off the light perhaps. That's energy efficiency. Hospitals and healthcare facilities that reduce energy consumption by adopting renewable energy sources, harnessing the power of solar energy, wind, for example, using efficient lighting, low energy medical devices, those all play into some of the environmental sustainable efforts. We also look into account waste management. So how does the hospital systems generate a lot of waste, especially OR units? How do we kind of mitigate some of that non-hazardous waste getting into our environment, which then in turn affects the population of patients, including ourselves, that we serve? So moving towards efforts that are being put at the organizational level towards reducing, reusing, and recycling waste. So a very small concept that we probably all learned when we were young, to recycle the plastic bottle, and moving towards, away from plastics and more biodegradable product use within our healthcare environments. Green building design also plays into this. So a lot of the hospitals are now incorporating environmentally friendly architecture, really kind of harnessing the power of the environment and greenery to reduce their carbon footprints. So things such as water-saving technology and using sustainable materials to build their healthcare facilities really will help the future generation. This ties into account the economic sustainability efforts as well. So a lot of healthcare burden is placed on the sickest of the sickest patients, right? A lot of the costs associated with taking care of patients that compromise large proportion of patients that are very sick, regardless of the environment that they're in, you spend a lot more money taking care of those patients. The insurance companies does, the healthcare system does. So how about placing more efforts and funding into preventive medicine services, public health and primary care to reduce long-term healthcare costs and reduce disease burden? So the economic construct of sustainability, economic sustainability also includes innovative healthcare funding. So innovative healthcare funding is part of the term that some of you may already know, value-based care, where there's a lot more effort that's being focused on patient-centered outcomes and basically incentivization of patient outcomes, less based on unnecessary use of medical procedures, labs, and imaging. So really focused on the outcomes of the patients to make healthcare practices a lot more sustainable. And there's a lot of hospital systems that have already been kind of working on that, including our own organization here at Cleveland Clinic. The third construct is social sustainability. So social sustainability is very important regardless of the environment that you practice in. So it includes two very important concepts, and this is especially something that I always tend to engage in when, as a primary care physician, is equitable access. Sometimes it's a little harder said than done because not all patients have the same amount of access and type of access to healthcare. So creating a sustainable healthcare system wherein you have equitable access for all to basic care services regardless of the socioeconomic status, health education, and ethnicity and geographic location. So with the use of all this technology that we probably heard before, how do we usually technically implement that to improve access for our patients? And that's a very, very important topic that, I work in my own clinical practice along with my vice chief and other administrators, increasing access and care for our own patients at the organization. So we reduce health disparities, we improve health care overall, and we significantly improve the health of the population. That really ties into the concept of community health. So the investment that you as a healthcare practitioner or the organization that you're working in, how do we foster healthy communities? So we focus a lot more initiatives, like I mentioned, on public health programs, vaccinations, health education. Those are small things that you would think make actually a large impact in the future, the lives of the patients that you touch, as well as the future generations, because learning goes a long way. And it also significantly reduces it improves health literacy, and it significantly reduces the disease burden that you will eventually see. So definitely, as a primary care physician, I try to educate my patients. I think education goes a long way, more than a lot of the medications that I prescribe, because you teach your patients to really have a sense of empowerment, and that health empowerment creates a ripple effect in the future. Sustainable health practices, the sustainable health practices is also a branch of what sustainability in healthcare looks like. So telemedicine, especially, we saw that after COVID. The use of telemedicine has really kind of sped up in the last couple of years. I use that frequently in my practice, as many of you might. It reduces the need, obviously, for travel, right? You're able to connect to a provider, physician, nurse practitioner very rapidly. It significantly reduces the need for travel, so you have reduced carbon footprint, improved access for your patients, and this is particularly true for areas that are significantly underserved in rural areas. And we commonly use that in our clinics here at Cleveland Clinic. It's great when patients are traveling and you're still able to access care, so there's continuity that's maintained, and that's really important for good outcomes. And obviously, the digitization of the EHR. So, all of that information allows for improved efficiency, but also reduced waste as a result of not really relying on paper charts. And at the end of the day, you are improving health accuracy for your patients with appropriate medical records and also reducing waste and costs associated with those practices. And lastly is the workforce. So all sustainable healthcare efforts requires a really strong workforce. So some of that involves training of your existing staff, but also focusing on retention and the interplay between both. So you have to ensure that your workforce, your physicians, your nurses, your staff, have a sense of empowerment to be part of that organization, that they have to be well-trained and adequately trained and feel a sense of support for the work that they do. That reduces turnover, improves the quality of care, and reduces the financial burden of healthcare. So a lot of the practices, I'm an early career physician, been out of residency for 4 years, and talking to physicians that have been in practice obviously longer than I have, there is a cultural shift towards this, where there's a focus on more mental health efforts, and like Dr. Aarons mentioned, burnout prevention and more injury, and what that kind of entails for the future. And that's really important, and not just for the people that are the backbone of the organization, but also at the very end of the day, it is a win-win for our patients because they form bonds with the providers that they serve, that serve them. So that's very important for maintaining continuity and improved health outcomes. And the healthcare organizations win at the end because it costs a lot of money to train and retain staff. So it's better that they retain them, because losing providers costs healthcare systems a lot of money, costs patients a lot of headaches and distress and health distress as well. So this is a very important topic that we've seen a lot of efforts at Cleveland Clinic, especially in primary care and other specialties, to focus on not only just recruiting good providers, but also retaining them as well. So I wanted to kind of highlight some of the sustainable practices that are being done at an international level. And we're going to start off with some of the strong initiatives that are being done at Cleveland Clinic. I'm going to highlight some of the things that have been done in some of the hospitals around the world, as well as right here in Cayman Islands. Okay, so to start off with, Cleveland Clinic, main hospital, and obviously in Florida, they have joint partnerships with all their facilities. And this is really interesting to know, because I didn't know some of these efforts that were actually being done at my own organization. So I know that we do a lot of investment into community health and population health, especially in the areas where our hospitals and our facilities are. But some of the things that I wanted to highlight is starting off with the Green Revolving Fund. So Cleveland Clinic has established a $7.5 million Green Revolving Fund that really just sort of finances energy efficiency and sustainability projects within their communities. It's almost like a grant and projects that allows for basically sustainability efforts in their own environment. And these projects, the savings from these projects are then reinvested into the populations around the clinics that are actually being served. So this is really like a win-win. There's also significant amount of changes in the buildings that are being constructed at our facilities. So we have green buildings. A goal that was actually set up was called Better Buildings Challenge, was to reduce energy intensity by 20% by 2020. And Cleveland Clinic surpassed 22% of energy savings in its facilities by that projected time. And these, like I mentioned, were things such as optimizing HVAC systems to include in the operating rooms, temperature control in unoccupied spaces, use of efficient lighting, also the use of better use of the existing equipment, so that you basically improve the energy efficiency of the products that you already have at your healthcare facility. There was also operating room adjustments. So a lot of the cost burden and waste actually comes from our operating rooms. So things such as switching out the machines that were not very energy intensive made some impactful use, as well as reusing materials that were not being used at the OR in a appropriate, medically appropriate way, so that all of these things are not necessarily not going to waste. There's also significant amount of investment into, like I mentioned, community and environmental health initiatives. So apart from these green buildings and infrastructure and energy efficiency, there's a significant impact that Cleveland Clinic has also made to the surrounding preventive medicine services and childcare facilities. So we have funding that's gone into removing things such as lead hazards from child care centers and home-based providers, because those can have significant detrimental impacts for the future developmental growth of children. And investing in programs in the communities, such as walkable streets, so green spaces, community spaces that allow for people to gather, perhaps have a vegetable garden, allow for improved jobs, local sourcing and hiring, really improve the health of the population as well. And then we also have your common practices of really educating the people that work within the healthcare system to reduce waste and reuse and recycle. So things such as not necessarily using plastic bottles all the time, or diverting non-hazardous waste away from facilities that are only processing hazardous waste. And the last but not least, like I kind of touched upon before, is the engagement training and fostering a culture of empowerment. So in Cleveland Clinic, we're all one, we work as a team, and really, as some of the other speakers, presenters had mentioned, it does take a village to take care of a patient. That's true for any specialty. So all the people that work at the organization play a very important role in taking care of the patient, but also taking care of their own environment and how sustainable it is. So educating and training the staff and fostering this culture of thinking about the future, not just in the present, but how does healthcare and the environment and the ecosystem really look for the future generations is very important. So this allows for a good interplay of exchange of ideas. It changes the way that people think about their practices, perhaps even as small as turning off a light switch when they leave their office. Those things can actually go a really, really long way. And obviously, because we like data, and like a lot of the academic centers do, they've measured all these by outcomes and metrics in their efforts, and they've showed significant amounts of savings in over excess of $1 million per year over the years, just from doing some of those smaller things, as well as some of the larger things that I mentioned. But obviously, there's still larger challenges, right? There's always ongoing challenges, even at large facilities that have a big impact with their population. So we always have to have an overhaul and continued efforts to really be able to, like I said, teach the people that we work with, to educate the patients that we are working with, to engage in some of their own sustainability efforts at home. Small things such as recycling a medication at your local pharmacy, for example. All those things really do make a big impact in the future. I also wanted to spend a few minutes on looking at the sustainable efforts that are being done in the international setting. Kind of looked at this in comparison to the work that's being done at Cleveland Clinic, as well as the work that's being done here in Cayman Islands, which we'll talk about in just a few minutes. So National University Hospital in Singapore and Rennes University Hospital in France. So these two hospitals have actually very similar sustainability efforts that they're engaging in. Two opposite sides of the world. But I mean, we can all learn from each other, and very similar in many ways despite the geographical location that we're in. So some of these efforts, for example, include, like I mentioned already, green design and low impact construction. So the newer buildings are now more energy efficient. We have rooftop gardens to allow for improved patient engagement as well. And everybody likes green spaces and ecosystems. Sometimes it's hard to find when you're in a big city. Improved energy efficiency within its own hospital systems, and obviously waste reduction, like I mentioned before. Some of this is also built into the fact that the hospital in France, for example, when they were measuring the amount of environmental impact that they had from cath labs and the energy and the waste that was actually being generated from that, they had a project to reduce the amount of energy and waste as a result of their cath lab procedures. And the project that they did showed that they had about nearly a 40% reduction in emissions and waste as a result of just recycling materials that they were able to at the end, and also making sure that the life cycle of their equipment was not being overutilized. So once it was close to its life cycle, refurbished versus brand new. So what are the cost implications of that, and what is the future impact of that? Something that's very important to balance. National University Hospital in Singapore, for example, they had a couple of different initiatives, but I wanted to just highlight just one. In their OR units, they had a couple of different things that they were trying to do. One was obviously utilizing the anesthesia like trays and equipments that were not being open instead of throwing them out. They were also switching to more digital workflows instead of like some of the paper charting that they were doing. And all of these concepts or ideas that were put together significantly improved paper and plastic recycling up to 230% in this small pilot that they did at one hospital facilities. Hospitals and their sustainability efforts, I do also want to mention, some of this also comes on the aspect of administration and leadership when they're looking at what are the sort of sustainability procurement efforts that they're engaging in. So the things that they buy, from equipment to chairs that providers are using, how environmentally friendly are they? I mean, are they, sometimes they're very expensive, but are they really durable? Are they ethically sourced? Do they have a reduction in the amount of plastic or materials that they're actually using? And some of that also comes on the level of administration in terms of cost versus benefits in terms of how they source some of these products. So this was also a little bit of a learning opportunity for me in looking at the sustainability practices that are being done at the hospitals here. And if anybody wants to also give me an idea of their own experience. So there's a lot of more efforts towards energy efficient buildings here at the public hospitals with solar panels, thermal lighting, green initiatives. So green initiatives allow for the use of harnessing solar energy. So that significantly reduces the amount of electricity that we're having. So energy reductions, as well as the environmental impacts as a result of harnessing or producing electricity as well. Also, the waste management and recycling programs, especially medical waste, is very important so that we have the least amount of environmental impact around us in a beautiful space such as the island. Water conservation also plays a large role, so there's improved use of water use, reuse, and irrigation systems and non-potable uses of water. Sustainable building designs, like I mentioned, so really incorporating nature with native plants and walkways that have more of the nature involved within their landscape. And obviously part of that also comes with the policy changes initiative. So how does the ministry and government play in helping these organizations support some of these sustainability efforts? What about the tax credits associated with being more of a green hospital? And also helping these hospitals engage in sustainable procurement policies so that there's less financial burden on the facilities, and government really should help with mitigating some of that. And some of this is already being done from the reading that I had an opportunity to engage in. And before we kind of dive into the next topic, I do want to kind of mention that we all have similar challenges across the geographical landscape. So some of the practices that are being done here, we can also incorporate into our own practices back home. So Florida, again, it's like very warm. Or do we see some of these things such as shaded landscapes and rooftop gardens at our facilities? No. Do I really hope we do? I think that'll be a wonderful opportunity to incorporate some of these practices here into our own facilities. I just wanted to touch a little bit upon this aspect of complementary and alternative medicine, the ecosystem, and how important the environment is in our own well-being. So our own well-being as healthcare providers, administrators, leaders, as well as the patients that we serve, and really harnessing the power of the island. So this is very important. Complementary and alternative medicine, traditional medicine, or integrative medicine is a really new branch of medicine that incorporates some of these practices of, herbs or other things that you might have heard, from people that were, ancestors and older than you. It's frequent questions that I get from my patients all the time, right? And I never really have a hard and fast answer. Is it FDA approved? This is not really against research or studies that I know of necessarily. Some of it has been validated from my own practices growing up as a kid. So how do we really kind of take into consideration the cultural aspect of people that we serve here on the islands and even back home, and really thinking about how some of those things can be incorporated into your own practice. So things such as ecotherapy, green spaces, healthy diets, simple as just sleep, stress management, traditional herbal medicine like turmeric that people say that reduces inflammation that people naturally cook with versus taking it as a supplement. How do you incorporate all of those things, such as local food sourcing, having gardens, food gardens, for example. I know one of my good colleagues of mine had that in her residency practice as a way of giving back to the community that she was practicing in. So all of those has significant sustainability impacts for your patients. So it improves health outcomes, right? It reduces medication waste and overutilization as well. And at the end of the day, you significantly reduce chronic disease burden and management. So I'm not saying that, medicine is very important, what we do is very important, but you also have to look at the transaction of culture and cultural practices when it comes to that. And you see a lot of that in islands, in smaller islands, as well as even in India, which is a big country where I grew up in, and really sort of mitigating some of that as, healthcare practitioners. Last but not least, I just want to touch a minute on AI and sustainable healthcare. I know that Dr. David, I believe, David was, okay, perfect, didn't want to butcher his name. He mentioned a lot about AI, but I think AI doesn't come without its own issues with sustainability. Not only is it there's a lot of cost, there's a lot of energy use and a lot of environmental impact as a result of harnessing the powers of some of these technological advances, right? Those big computers that you see have a lot of microchips. Where are those microchips coming from? How much energy and waste and environmental destruction do we actually have from manufacturing those microchips? For example, some of the things that you may not have necessarily thought about. It takes a lot of environmental impact and energy to do that, and especially at a small level versus a large scale, such as these big machines that generate all this useful information for us. So something to think about. Though AI is really great at, diagnosis and decision-making processes, is really good for places that are more remote and rural, especially in preventive medicine, which is a little bit more easier to apply in your telemedicine or virtual approach, and you can incorporate AI easily into this. It does have environmental impacts, so we do have to look to see what are the practices that we can have in the future with AI and improved environmental impact and resource allocation as a result, right? So how do we mitigate some of those environmental challenges and sustainability efforts by still promoting the use of AI within our own healthcare practices and reduce the impact that it has towards disease burden for our patients, as well as the environmental impact for our patients and for ourselves? So I won't dive too much into some of these examples, but I really like the use of ambience. I'm really glad that Cleveland Clinic got it. It reduces my time for dictating notes in literally house, so I can be out of there by 5 and I don't have to log in. So I can understand the efforts associated with it. And we have some of these newer technologies, like Google Health, for example, has great partnership with working with radiologists to improve, obviously, radiology imaging, and Babylon Health, which I'm not sure if some of you heard about before, but it was basically an Android and Apple platform where you can just log in with a subscription and have access to provider at any time. So things are great, but we also have to think about the impacts of the environment and sustainability when we engage in any sort of technological advances. So that kind of concludes the end of my presentation. I did want to highlight our in-country representative, Shanika. She is right outside, along with JP, who's right here in the front. They're our international relation partners. They're awesome. It really helps to navigate some of the integrated healthcare that we have with longstanding partnership with the government, as well as healthcare facilities here on the island. So I see a lot of patients that are global patients as well. It's something that I had not seen in my previous practice when I was in residency. So this is really nice. It gives you a different cultural perspective, and our team's here to really kind of help navigate that as well. And something that I didn't put on the slide is our Center for International Medical Education. So I'm an international medical graduate. Observerships and clinical cursors are something that we have at Cleveland Clinic. I think it's a great opportunity for people to really learn about different healthcare systems and practices around the world. And we have a significant number of observerships and preceptorships at Cleveland Clinic in Florida. So that's something that if you wanted to find out more information about, can definitely let you know. Thank you.
Good afternoon, and thank you so much for this presentation. I just wanted to thank you especially for touching on the cultural aspect of nature, because it does seem a lot of the time that the conversations about green initiatives and green space are in a vacuum, where they're not talking about the native plants or those cultural relationships with the natural environment. I wanted to touch on something that you were mentioning about the traditional medicine and ask your opinion on, because a question that comes up a lot, my doctoral research is in ethnobiology, focusing a lot on plant awareness and traditional plants. And what is your perspective on how, because as you mentioned, there's a lot of research missing, especially for some of our local plants. So while the health benefits of other traditional medicines might be well studied, a lot of our local plants are not well studied in that instance. How could people advocate for that research to occur?
Yeah, I think that's a really interesting question. So my interest in medicine actually stemmed from clinical research. So I think that that's a very important aspect, especially in primary care. To really think about your question, I think it's important for primary care providers especially to engage in some of those research efforts, because I can say that for myself, a lot of the research that's really being done at the high level are very much specialty based. As primary care, we really don't engage in a lot of research efforts. We might research about medical conditions in our patients, but how much of thinking outside the box do we actually look into? We really don't. So I think it starts with preventive medicine, because a lot of those kind of efforts, whether it's looking at holistic medicine, or it could be anything from a small herb to like a supplement that you can get at GNC, for example, how does that really tie into the overall health of the patient, what medication they're already taking? And those things we're not going to know for years, right? How do they cross-interact? But I think that from my perspective as a primary care provider, I would really advocate for my own specialty to engage in some of those inquisitive research initiatives. So I do that in my own clinic, on my own effort. I have medical students that I partner up with to give them research projects to look into those kind of things. So that's where it really stems from, because I don't think we do too much of that at the forefront. And I think all the specialties are important, but we're pretty much the first line, first interaction that we see with patients and have a long-standing relationship with. And those things really do make a difference at the very end of the time. And I always tell patients, listen, I can't tell that something's been working for you for 60 years. I can't tell you to stop, and I can't tell you to continue. Sometimes there's a little bit of the fine line. There's a little bit of a politics and ethics associated with things that you do. So you have to kind of straddle that fine line as well. But hey, sometimes you just don't know. So I think there's a lot more effort that needs to be done to really kind of learn. And maybe these chatbots, AI could help us with that and gather that data, from all around, because things that are being done here are probably being done at the other side of the world in a very similar manner.